if you lie down after eating, you may have LPR. So if you want to know what LPR is about, come and watch this video. Hi, my name is Paul Mok. I'm in private practice. I work at Mount Elizabeth Novena in Farrer Park Hospital. My interest is in voice swallowing disorders. Okay, so if you take the term laryngopharyngeal, so laryngo means voice box and pharyngeal means the throat. So reflux is when there's acid coming up from the stomach going up into the throat. So when the acid comes up into the throat, it causes inflammation, swelling in the throat, and the patient feels uncomfortable. So there will be throat clearing and phlegm, because phlegm is produced as a result of the injury and the body is trying to protect itself. So then you have all the symptoms as a result of the injury from the acid. When the acid comes up into the throat, it will come into contact with the skin or the lining inside the throat. And the lining is sensitive and normally does not come into contact with the acid. So when it comes into contact, it damages the skin, which becomes swollen, and that gives rise to produce mucus. It's capable of producing mucus, and this mucus will be sensed by the patient, and they will have like a sensation of something stuck inside the throat. Okay, so at the same time, they will have an irritation. So the throat, the nerve receptors become very sensitive. So that can lead to cough. And the overspill of the acid into the voice box can cause hoarseness. Usually it's because the patient has poor lifestyle habits. For example, having a late meal and then lying down very soon after. Usually we will advise 3 hours of not lying down after you finish your meal. So if somebody finishes the meal and lies down very soon after, then the acid comes up more easily. Also, if a patient wears very tight clothes or overeats, then there's increased pressure within the stomach, which causes the acid to come up. Then there are other things like depending on what the patient eats. So there are certain foods that predispose towards reflux. For example, if you take fried, oily, spicy food, dairy products as well, caffeinated products, alcohol, and then snacks like nuts and chips can increase the acid production, and that worsens the reflux. Most times LPR is diagnosed clinically. So we see where the patient, what kind of symptoms the patient is having, where the symptoms are located in the neck. Most times the symptoms are located in the middle of the neck, over here below the Adam's apple. So that is quite classical of acid reflux. So we would normally start the patient on treatment, and we will assess the response to treatment, and also to lifestyle and diet changes. Right? If the patient is not getting well in spite of their lifestyle, diet change, taking medicine, then we may need to do further tests. For example, there may be like pH monitoring, and also we would send the patient for a scope into the stomach just to check the stomach to see if there are any predisposing conditions, for example like a hernia, where part of the stomach comes up into the chest, and that can produce acid which in the chest, which comes out into the throat more easily. Yeah, so definitely lifestyle changes are very important. So for example, if somebody eats late or has a habit of eating and then lying down very soon after, either to watch TV, to read, or to sleep, then they are going to be more predisposed towards to having reflux. If somebody is overweight, for example, then the mass of the abdomen pressing on the stomach will squeeze the acid up. So definitely active lifestyle, losing weight is very important as well. Now there's something that people don't realize. Obesity may be related, or is often related, to sleep apnea. And in sleep apnea, what happens during sleep is that these patients have a blockage of the upper airway where air is not able to go down into the lungs. So these patients will struggle to breathe. And when they struggle to breathe at night in their sleep, they are compressing the abdomen against the stomach, and that worsens the reflux during the sleep. Also, what you eat, the choices that you eat, because you know that food is related to reflux, is very important. So that is a lifestyle choice as well. Most of the problems associated with reflux can be chronic. For example, persistent throat clearing, which can be very socially annoying. They can cough, and again, that is very troubling socially. In terms of serious side effects, probably the most serious thing could be affecting your voice, so that the voice may become very husky and very hard to project. It's very hard to talk, so that is a problem. There are reports where reflux may be associated with cancer. Now, whether it's an association or whether it's a causal relationship is not very clear, but only a very small fragment of people may develop cancer as a result of reflux.